Whenever you want to move, your body relies on a brilliant, high-speed communication network. Your brain acts as the sender, dispatching clear electrical signals that travel seamlessly down your nerves straight to your muscles, telling them what to do. But with a condition called myasthenia gravis, a kind of static enters that communication line. The messages get scrambled right before they reach the muscle. Because the signal cannot get through, patients experience physical symptoms like drooping eyelids, double vision, or sudden severe fatigue in their arms and legs. To fix the static, we first have to find out where it is coming from. For many patients, the source is a small organ located in the upper chest called the thymus gland, acting like a rogue dispatcher. Biology shows us that this gland can produce abnormal immune cells. These cells release specific antibodies that travel through the body and physically block the connection points where the nerves speak to the muscles. Because the muscle itself is healthy, treating the muscle directly doesn't solve the problem. To restore clear communication, doctors often recommend removing the rogue dispatcher itself through a procedure called a thymectomy. This approach is backed by years of international studies. Evidence shows that removing the thymus gland effectively clears the static and improves overall control of the disease. When the symptoms are controlled at the source, patients often see a drastic reduction in their need for heavy, long-term medications, and they gain a much higher chance of achieving sustained remission. Looking at this diagnostic flowchart, we can see exactly who benefits most. Surgery is internationally recommended for two specific groups. The first pathway is for patients who test positive for a specific type of static, called generalized acetylcholine receptor antibodies. The second pathway is for patients who have a tumor on the gland, known as a thyoma. Before reaching the operating room, patients go through a comprehensive neurological evaluation. The care team ensures that the disease is as controlled as possible before any surgical steps are taken. For individuals matching these criteria, a thymectomy is a thoroughly validated, internationally supported step toward reclaiming their health. Historically, removing the thymus gland required an intense procedure called a median sternotomy. Surgeons had to completely divide the bone down the center of the chest. While effective at removing the gland, this open chest method came with a heavy physical toll. Patients faced significant postoperative pain, prolonged hospital stays, and a long, difficult recovery. Today, thoracic surgery offers a gentler path. It's called video-assisted thoracoscopic surgery, or VATS. This side-by-side comparison shows the difference in approach. Instead of a large incision through the breastbone on the left, the modern VATS technique uses a few tiny keyhole incisions. Surgeons use a high-definition camera and specialized long instruments to perform the entire operation. The medical goal of the operation remains exactly the same, but moving to keyhole cameras drastically reduces the physical trauma inflicted on the body. Because the incisions are so small, patients experience significantly less pain after the operation, and the resulting scars are minimal. Less trauma means the body heals faster. Patients spend less time in the hospital bed and can return to their daily routines much sooner. Despite tiny spaces, high-definition cameras give surgeons a perfect view to fully extract the thymus gland. Long-term data shows the most important outcome. Neurological recovery for VATS perfectly matches traditional open chest surgery. Patients achieve the exact same neurological cure, safely spared the heavy physical recovery of open surgery. Delivering these modern results requires institutional expertise. At Cairo University, the dedicated thoracic surgery unit, led by Professor Dr. Tariq Mohsen, has built a specialized program specifically for this procedure. A successful minimally invasive surgery requires a highly coordinated team. Neurologists, anesthesiologists, surgeons, and rehabilitation specialists all work together to plan the procedure. Before the patient even enters the operating room, this team reviews their complete medical profile. They optimize daily medications, carefully check respiratory function, and map out the safest possible surgical path. The hour in the operating room is actually the centerpiece of a deeply personalized, meticulously planned medical strategy designed around patient safety. Because of this extensive planning and the precision of the VATS technology, the team at Cairo University implements enhanced recovery protocols. This fast-track timeline allows many selected patients to safely pack their bags and go home the very next day. In some highly specific cases, it can even be performed as a day case surgery with no overnight stay required. Every individual is unique. The right surgical choice is always made through careful, detailed consultation between you, your neurologist, and your thoracic surgeon. A VATS thymectomy clears your internal lines of communication and lifts the daily weight of the disease, helping you return to your normal routine as quickly as possible.